I want to start by acknowledging my co-authors on this work, Pinar Karachamandik, who's a health economist at the University of Minnesota, our fantastic research assistant on this work, Drew Wilcock, my co-PI, Erica Franklin Fowler, who's actually presenting in this lecture series, I believe, next month. So she'll present kind of part 2 of this project. Laura Baum from the Wesleyan Media Project, and then our other co-authors, Colleen Barry at Johns Hopkins Bloomberg School of Public Health and Jeff Niederdeppy at the Cornell Communication Department. And this is truly an interdisciplinary collaboration because we draw from health policy, health economics, communication, and political science in the approach that we're taking. Our funding comes from the Robert Wood Johnson Foundation SHARE program, as well as funding directly supported from Wesleyan University and McKnight Land Grant professorship that supported me at the University of Minnesota for the last 2 years. So this is information that's not a surprise to anyone in a health policy-oriented audience like this one, but I wanted to just start by telling you about the context in which we're examining media. So we're looking at media during the first open enrollment period, way back when, in October 2013 to March 2014, an additional 2-week period when people in the pipeline could still enroll. And this is the period when new insurance plans were available through the federal marketplace and state-based marketplaces, and the Medicaid expansion enrollment was beginning. So with the kind of 2020 hindsight, we now know that this was a period of great health insurance enrollment. And so I'm showing this figure just from ASPE, which shows the number of new enrollees in the marketplace over that 6-month open enrollment period. And I want to pause and focus on this because we all know this intuitively, but I ask you to think about it from a health behavior perspective. So I work with a lot of colleagues in health behavior and health communication where we're trying to understand what influences behaviors like smoking cessation or getting a vaccine or cancer screening. And we're usually looking at a plausible, relatively low likely influence of media on that outcome. If you think about behavior change like obesity or obesity prevention, weight loss. But here we're talking about a behavior that 8 million people partook in during a 6-month period. And so that's why we're really interested in understanding if there was any plausible association between the media, both local news media and marketing going on during this time period and enrollment. So we also, of course, now know that there's been huge declines in uninsurance in the United States as a result of the ACA. And as many of you may have seen in the New York Times article yesterday, we now have a better sense of who particularly benefited from these insurance expansions. So these data came from the Minnesota Population Center in Shadak, where I work at the University of Minnesota. And we've seen these increases generally predominated among more socially vulnerable groups in society. Communities of color, low-income workers really saw the bulk of these increases, which is, I think, a point to celebrate about the Affordable Care Act. So during this time period, there were many different possibilities for information to reach the public. So there was, of course, a lot of enrollment advocate work, work directly on the ground by outreach coordinators and navigators. But there was also a lot of media messaging that wasn't always in sync. So what you see here, does anyone recognize the image on the top left? So that's Paul Bunyan. And he was the representative for marketing the MNsure, the Minnesota state-based marketplace in 2013 and 2014. We also have a private insurance ad from Cigna. We have the national news media discourse, which tended to focus on failures in enrollment and in healthcare.gov. And then finally, I've also shown a screenshot from a political advertisement that is anti-Obamacare, anti-ACA in advocating for candidates who took opposing positions. And the bulk of the political advertising during this period, and to date, that referenced the ACA is negative. And so I want to stop and just show you 2 examples, because when I do a talk about media, people seem to like watching media. So. No. All right, we'll do it this way. So just two examples of state-based marketplace ads during this time period. And in our data that I'll describe in a moment, we know the number of times these advertisements were aired, when we know the dates that they were aired, and we know the cost. We know the expense of each individual ad. So in this context, as I already mentioned, our big question is, was there any impact of media messaging on enrollment during this time period? And so we know from survey data, from Enroll America, from the Kaiser Family Foundation Health Tracking Poll, and other sources, that people did attend to this media. So enrollees in April of 2014, an Enroll America survey noted that news media was their most dominant way of getting information about the marketplace. They also report, over half of them reported seeing ads, such as the ones I just showed. Local TV news is the dominant source of information for Americans. Potentially not you in this room, but media surveys by Pew and other organizations continually show the dominance of broadcast local TV as information sources on politics, crime, weather, everything else that people want to hear about. And from previous work that we did in advance of this study, we found strong evidence of local variation in news media coverage. We also know that health insurance enrollment is necessarily a local phenomenon, given the differences in prices, plan availability, number of issuers, and the political context across local areas and states. So the key question that this grant, this SHARE project asks is, does this local variation in news media volumes and content influence local variation or shape local variation enrollment outcomes? And our project has three aims. I'm focusing on the third for today, but just to give you a sense of what we're doing in this project. We're examining the content of local television media, political advertisements, and insurance advertisements that were aired on broadcast television during the first 6-month open enrollment, just really descriptively to characterize what that media looked like. In the second study, we're looking at how local characteristics are associated with internet search behavior, Google Trends data on searching for health insurance related terms. And then finally, we're looking for correspondence between volumes of media messaging and changes in health insurance enrollment between 2013 and 2014. So the specific research question that I'm focusing on today is, are county level declines in uninsurance rates during the first open enrollment period associated with higher volumes of insurance advertisements? And secondly, we also look at those two other rival sources of information for Americans, information on local news and information in anti-ACA political ads. So our data for a key outcome, our uninsurance rates, comes from the American Community Survey at the county level. We're using the 1-year estimates of uninsurance, which are only available in counties that have more than 65, with a population of more than 65,000. In 2013, that amounted to 700 counties. In 2014, that was 712 counties. And our study sample is the union of those, so available in both the 2013 data, the 2014 data, and without missing data on our covariates. And so we ended up with 629 counties in the data set that I'll tell you about today. And that encompasses 80% of the population, because we are looking at the more densely populated counties in the United States. Yeah?
So since uninsurance rates can be due to a lot of things other than enrollment,
Absolutely.
why don't you just use enrollment data?
So we have done some second analyses using ASPE enrollment data into Marketplace directly. And the data we have available are just the healthcare.gov states in the ASPE data set, the public data. So we are looking at that in kind of second analyses, and we're also going to be looking at this at the individual level using restricted data from Census and NHIS eventually at the individual level with restricted county level identifiers. So we're moving into those other approaches. And I'm more than happy to take questions throughout, so please interrupt me. So our media data are at the level of the Nielsen DMA, designated market area. Counties are neatly embedded within DMAs, which makes this easier. So every county gets assigned the media data from the DMA in which that county is embedded. Our data come from Kantar CMAG through the Wesleyan Media Project. And what we have is we have every insurance creative aired. There were about 1,000 during that 6-month open enrollment period. the sponsor, the date, time, and station in which it was aired, the cost of the ad. And from that, we construct measures of volume of insurance ad airings. And we can break it down, as I'll show you today, by private sponsor, federal, healthcare.gov advertisements, state-based marketplace advertisements, and ads by enrollment advocates or other. I can talk about what that means. We have the same data for political ads. And so we can construct a volume of airings at each DMA of ads referencing ACA or Obamacare. And then for local news, right now we're really using a pretty blunt measure of news attention to the ACA based on closed caption searches. So the Wesleyan Media Project and a number of very eager and hardworking research assistants looked at data on closed caption searching in the top 2 highest rated evening news broadcasts for the 210 DMAs. So this was whatever the top 2 rated news programs are between 4:30 p.m. and 11:30 p.m. in that market. And we have a measure of the number of times those stories referenced ACA-related keywords. And so it's a measure that's a continuous measure that right now we're not looking at the content of that, but we're just using this as a measure to control for plausible agenda setting, plausible attention to the ACA in those markets. So this is what a media market looks like. I have Minneapolis. I'm sorry I have a much prettier map for the Minneapolis media market. Don't take it personally. But what you can see in the Chicago media market, as well as the Minneapolis-St. Paul media markets, as I described, have counties embedded within them, and they can cross state lines. So you can see most of the population in the Minneapolis media market lives in Minnesota, but some lives in Wisconsin. The same is true of the Chicago media market, where 91% live in Illinois, 8.6% of people who are in the media market, Chicago media market, actually live in Indiana. So then we bring in a host of other demographic variables. So we have demographic estimates at the county level for both 2013 and 2014, and these are time-varying characteristics. So we have a measure of each of these demographic characteristics for each county in 2013 and 2014. So we're able to control for the population size of the county, the proportion male, the age distribution, the racial and ethnic breakdown, education level in that county, income to poverty ratio, and the proportion unemployed. And we also include a control that is time invariant for the proportion in that county who voted for Obama in 2012. We also bring in state and ratings area characteristics into the analyses. So at the state level, we include whether that county is in a state that expanded Medicaid or not, is in a state that ran its own marketplace or not. We have data on the funding levels for insurance enrollment, consumer assistance, essentially, from the Robert Wood Johnson Foundation HIX, sort of the implementation data sets that RWJ has been creating. And then we have the Herfindahl Index for the individual insurance market, also measured at the state level. And these are all time invariant characteristics of the state. And then we have ratings area marketplace characteristics. We create a crosswalk to link the ratings area to the county. And we know the number of silver plans available in the marketplace, the number of issuers offered in the marketplace, and the cost of the second lowest silver plan premium. So our analysis you can think of as panel data because it's at the county year level. So we have over 1,200 observations for every county in the 2 years of the data. Our sort of key analysis looks at uninsurance rates as a function of the post period. So we have an indicator variable for 2014, and we anticipate that coefficient is going to be negative, allowing for the declines in insurance we expect to see attributed in the 2014 time period. Then we adjust for media, the media volumes that I just described, measures of the volumes of insurance ads, of political ads, and of news attention. And our key coefficient then is the interaction between the post period of 2014 and the media variables, which allows us to assess whether changes in insurance between 2013 and 2014 varied by the levels of media in that market, in that county, excuse me. And then we include all of the other variables I just described. And we also include a pre-ACA measure from January 1st to September 30th of 2013 of the ad volumes prior to open enrollment as a control. Our standard errors are clustered at the state. And so there's certainly limitations of this approach.
What would be the pros and cons of including regulated control for like prior years insurance?
Yeah. Yeah, so we've run models with and without. We're trying to, so the key limitation of this is the targeting that's happening. So insurance marketers, have a lot more data than I do, and so they're choosing when and where to run their spots. And so by adjusting for the levels prior to open enrollment, and by adjusting for what essentially is the level in 2013, the non-interacted component of our media variables, we're trying to account for that. We've also run the models with and without a lot of the demographic characteristics, and particularly when we exclude the funding for consumer assistance, which is likely correlated with insurance marketing, and the results are pretty stable to that. But it's an important question. Yeah.
So this is regarding your second point. What degree is volume of ads equivalent to receipt of actual ads? I'm wondering if, particularly maybe if older people tend to watch more local news, would you expect differential effects among that group?
Yeah. Right now these are aggregate measures. We don't have any idea how many ears or eyes were actually on these broadcast media messages, which to some extent, so I'm somewhat familiar with the literature on media exposure in communication and political science, and some of that says it's actually better to have ecological measures when you're not relying on individuals' attention to or recall. So individual measures of recall or exposure can be really biased because they're correlated with lots of other things like education status. And so researchers don't always want that when that individual variable of did you hear or see an ad actually is in the data. Sometimes that has biases associated with it. So we're keeping this all at the ecological level for this analysis. When we are able to move into looking at the individual level, we will be able to look at differences in maybe sensitivity or changes in insurance by social group. But we're not really, so by individual social groups, we'll be able to see, our young people, is the association of ads and enrollment higher among younger people or older people, or people up to 400% of the poverty line or not. So we'll try to get at some of that subgroup differences in the later stages.
So your measure of messages is the number of ads.
Correct. It's the ceiling. No one was exposed to all of the ads, and I'll show you what that looked like. But it is absolutely a ceiling of potential media exposure. Yeah.
Spanish language media, how do you think about that?
So that's a really important and great question. We coded for Spanish language or not, and we haven't brought that variable into these analyses yet. So the data included all the Spanish language ads as well. It just made it harder for me personally to code them when I watched them. So I hired an RA who had Spanish as a first language, and he helped me a lot. So just to move on to the results. So evidence of the Affordable Care Act working, yet again. So this is this sample, so these larger counties of 65,000 or more. You can see the trends in uninsurance rates from 2009 to 2013, and then the expected declines in 2014. And this will kind of help the conversation we've just been having to think about what kind of media volumes are we been talking about. And because they vary so much, it's not, the first row shows the mean, and that's not really meaningful because nobody is exposed to the mean number of advertisements. There was high variation across counties. This is at the DMA level, so across media markets, we see in insurance ads sort of a low volume market might have seen up to 114 ads. A very high volume market, if you looked at it, the 90th percentile, might have been exposed to 8,500 unique advertisement airings that reference insurance. The political ads are a lot lower in frequency and a lot lumpier in the distribution. So this is the open enrollment period from October 1st, 2013 to the end of open enrollment in March of 2014. And so there wasn't actually a lot of electoral activity going on then. The 2013, there were isolated campaigns in the fall of 2013, but those were mainly strange races, mayoral races, off-cycle election year. And then the 2014 election was heating up, and there was a lot of discourse around Obamacare and the Affordable Care Act, but we weren't at the height of that by the end of open enrollment period. And so these are really geographically dispersed distributions. The news keyword hits was sort of more evenly distributed across markets. So a median market, our measure of media attention was 726 keyword hits. A high volume or high attention media market would have had over 1,000 hits in the top 2 highest rated news programs over the 6-month period. So just to explain this variation even more, what I've shown you here is kind of a heat map where darker colors indicate higher volumes of insurance messaging. So the darkest areas had over 10,000 spots or airings of insurance ads during this time period, and the lightest color is under 100 airings. And now I'm jumping to without a very good transition, I'm jumping to the key result here. So just to orient you, so this is regression. These are regression coefficients for that year indicator variable at the top, and we see that's the expected negative and statistically significant result, showing that in the year of 2014, there was lower uninsurance than in 2013. We also, here at the bottom, see that there is a positive relationship with the volume of airing of advertisements prior to open enrollment and insurance, meaning that there were more ads aired in higher uninsured markets. And then our key coefficient is negative and statistically significant, which is you can essentially interpret as for an increase in 1,000 advertisements is associated with a negative 0.1 percentage point decrease in the uninsurance rate in that county. We also see, just to continue walking through it, we see no relationship between uninsurance rates and the volumes of political ads, or the change in insurance and political ads. Nor do we see any statistically significant relationship with attention to ACA and news media.
Does this control for the employment rates?
Absolutely, yeah. So all of these adjust for all of the state and county level characteristics I just described. Yeah.
So this sample includes potentially people who gain insurance under Medicaid as well?
Yes, correct.
So what I'm
Yeah.
wondering is, even with the ACS, you could create simulated eligibility based on FPL's
Mhm.
household income. You could probably figure out who is actually eligible to enroll in the healthcare marketplaces.
So we can do that when we have our hands on the individual ACS data. The county level, we're just including controls for the county level poverty. The proportion under 100% of poverty and under 400% of poverty in that county. And we don't interact that with our media measure. We include the controls in 2013 and 2014 to adjust for the change in composition of poverty between those 2 years.
Well, I guess even at the county level, you could exclude people who are extremely poor.
So we're not looking at individuals at all. So the unit of analysis is at the county. Yeah, but it's exactly where we're going with the data. So this is using public data to look at individuals living in the counties. We have to use, we went through all of our security clearance to get the county level, the county of residence indicator for individuals in ACS, which is the way, the New York Times analysis that came out yesterday used exactly that approach.
Can you worry also about catastrophic failures of states where there was a catastrophic failure of the website?
Yeah, I mean, so that brings me very nicely to the next slide, when we've begun to do a series of sensitivity analyses. And so one of those is to include state fixed effects. So now we're really not looking across states, we're only looking at variation in media volumes within a given state context. And so that's in column 2. So column 1 here shows the exact same model I just showed, including all of the characteristics, the state and county level characteristics I described. Our second model shows the state fixed effects, which allows us to estimate the variation within states, so within the counties we have available to us, among the counties within the state. And you can see that our key coefficient doesn't change at all, actually, with our estimation with state fixed effects. And then the final set, we fully interact them. So for every time invariant characteristic, we interact with year to assess, for instance, whether the proportion voting for Obama was associated with changes in insurance and not just levels of uninsurance. And when we do that, we still see our key coefficient at about the same magnitude. Yeah.
I'm trying to get a sense of the size of that.
Yep. You are all set up extremely well for my next slides. So this just kind of tells you, this doesn't answer your question, Harold, but it tells you what that slope looks like as you increase the volume of insurance advertisements and the declines in uninsurance rates. But now, kind of trying to really understand, what does this even mean? How many people are we talking about? We've done some really preliminary kind of back of the envelope or back of Excel kind of calculations here to get at this question of magnitude. So a county in our data set at the 25th percentile of ad volumes aired would have been exposed, again, this is that absolute maximum, no individuals exposed to this many ads unless they really have a lot of free time, to over 1,200 ads aired, whereas a county in the 75th percentile of ad volumes would have been exposed to over 7,000 ads. So that difference from 25th percentile to 75th percentile of ads aired is about 6,000 ads, and so we can estimate that would correspond to a 0.65 percentage point decline in the percent uninsured. So for an average county in this data set, that would be about 2,200 people gaining insurance in a county. So I would appreciate any feedback you have on how to think about these magnitudes would be great.
Well, I don't actually have feedback on the magnitude.
That's okay.
And so maybe you're going there, but were you able to break down the insurance ads by whether they were, it was
That's my next slide. Thank you. We rehearsed. No, not my next slide. It's 2 slides from now. So then, just because I think it's quite interesting to think about, although I'm really focusing on the top half of the regression models and looking at the media, there's also lots of interesting and predictable, which makes us feel like this analysis has some validity to it when we look at what other characteristics are associated with insurance rates. So a Medicaid expansion state has lower uninsurance rates. Percent voting for Obama at the county level also associated with lower uninsurance. Counties associated with higher uninsurance, and this isn't change at the individual level like the New York Times article yesterday reported on. This is at the county level and associated with the levels of uninsurance. So we see higher uninsurance rates among more populous counties with a higher proportion of older people compared to younger people, higher percent Black, percent Latino, and higher poverty levels. And we don't see associations in this data with this particular analytic approach with some of the marketplace and insurance market characteristics. So Colleen asked, does the type of ad matter? And so our first approach was, again, overall volumes in the market to see if there's any plausible correlation with the volumes of media messaging and insurance enrollment. And in this table, we break it down by using the same analytic approach, but break it down by type of sponsor. So you can see that the 2 types of ads that appear to be driving this effect are ads sponsored by states, like the MNsure ad and the Get Covered Illinois ad I showed at the start, and ads sponsored by insurance and enrollment advocates. And so these are spots that generally told people about an enrollment event that was happening soon. They were sponsored by organizations, nonprofit organizations, as well as oftentimes television stations themselves would provide free advertising about enrollment, opportunities for enrollment and enrollment events. And those are the 2 types of ads that we see so far show more of the association. Yep.
Was not.
Yep.
So,
Neg-
getting back to your question, it makes you wonder if it's primarily having an effect on Medicaid rather than the exchange.
Yeah.
But, I mean, obviously, Get Covered Illinois was trying to do both.
Right. Yeah. Yep. That's true.
Yeah.
That was my sort of question. So
Yeah.
do you think that, do you have data on concomitant ads specifically for the Medicaid expansions, if that existed?
Yeah, so one of the things we coded for in watching each ad was whether the ad mentioned Medicaid or not. We haven't put that in this analysis yet. Yep. So some private ads mention Medicaid too. They're not. The rare was an ad for Medicaid. So we could bring in a variable for whether the ad mentioned or focused on the Medicaid population.
Yeah, they're just thinking that there's still county,
Mm-hmm.
there's
Yep.
still county level data that we've had on the percentage of people in the county who were on Medicaid or could be eligible for it.
Oh, okay. So
things like county level
sure.
people were eligible but didn't take it up.
Yeah.
Before, so
Okay, I see what you mean now.
That's kind of what I was getting at.
Yeah.
Kind of incoherencies are.
No. It just took me a little while. I understand. And so we haven't looked at, we could create a measure of Medicaid eligibility and include as a control. We could also think about it as an outcome too. So, yeah.
Right.
Yeah.
So there may be some spillover.
Yep.
Because like if you hear about the marketplace,
Yeah.
you may also be like, hey, I'm not eligible for that, but by the way, I hear that Obamacare also
Yeah.
extended Medicaid. So
Yep. And some ads and some sponsors of ads actually take that notion of spillover seriously and make it the focus of the ad. So unfortunately, I didn't bring in an advertisement probably find it. There were some Blue Cross Blue Shield, other private insurers saying, you may have heard about changes to the healthcare system, and we want you to know that our service has remained the same, or some kind of sort of anti-healthcare.gov with the goal of bringing people in to private insurance.
I wonder if some sort of interactive specification of expansion or non-expansion.
No. So we haven't looked at we haven't done a triple interaction, basically year times ads times Medicaid expansion.
Because that would be one way
Yeah.
to get at some of that.
Yep.
Yeah.
That's a good suggestion. Oh, sorry. Yeah.
My premise here may be inaccurate, may be wrong, but I'm under the impression that you see more public service ads when the stations are not selling ads. In which case there's sort of hidden information, and you sort of, state ads about things about the local vibrancy of the economy or something that could have a different route.
Yep. Right, because some of the ads we have the information on how much that ad costs. Also, so we could do some kind of stratification where we look at the public service ads and the more expensive advertisements. I don't think that's what you're getting at.
Indirectly, it's really whether what you're seeing when you see a lot of the public, like a state ad, the public service ads, is you're seeing that nobody is buying the ads in that market. And it tells you it's additional county level information, economic information, a new window besides the other county level data. This may be fanciful, but
Yeah. No, I see your point. So in markets, and we thought about trying to get at that by bringing in, say, the volumes of advertisements for Nike shoes or Coca-Cola or something, and thinking about when there's more space or there's more of the ad hole that could potentially be filled by insurance ads, and thinking about sort of an instrumental variable approach. Unfortunately, we weren't able to buy that data at the level of our share grant. It did not allow us to purchase those. But I think I see your point now. So there's going to be some media markets that are it's simply easier to broadcast ads because they're cheaper markets. There's not as much competition for the space, for the 3 minutes between segment.
And that could be correlated with things about the labor market, which makes them
Yep.
more or less interested in especially Medicaid or perhaps other.
Yep. Yeah.
So what you're talking about is basically we're talking about the quality of the ad, and you don't have a measure for that right now, but I would think that the cost would be a good measure of the quality of the ad, because that's going to be correlated with how many messages, how many people are affected by it. Or
Yeah, or how valuable how valuable the sponsor thought the ad would be in that
a good
market.
measure of the quality
Yeah.
of the
Yeah.
ad, and would be another way to look at
Yeah.
this.
Yeah, so also a good segue actually to starting to play with this cost variable and thinking about what an ad might be worth. So just to show you, so we don't see a relationship with political ad volumes or news attention, but we do see this intriguing relationship between insurance advertisements and insurance advertisements and insurance changes, and particularly among the state and enrollment advocate ads. So in thinking about implications, again, we haven't really started to use this cost variable that we have to the extent that we could, and to the extent that some of your suggestions are making me think of. But we do know that there were 593,251 insurance ads aired over our sample population of counties during the open enrollment period 1. And that when we just simply sum that all up in our data set, we find that was at a cost of about $167 million. For reference, I looked up Wesleyan Media Project data on political ads. So in the first 6 weeks of 2016, political candidates spent about the same amount on political ads already. So about the same in 6 weeks compared to 6 months of open enrollment period. So then we've done really simple averages and some very simple division to get at this maybe silly number, but I thought I would try it out here. So given the volumes of ads, we can estimate the cost per airing for the mean DMA, which is $176 per ad. We show that difference, that magnitude that I described of 6,122 ads, which was the difference between the 25th percentile market and the 75th percentile market, would cost about $1 million. That was equivalent, as I described, to 7,567 people gaining insurance in a DMA. So I before told you the county, but in fact, the media messaging is at the DMA level, so we want to aggregate across the counties in the DMA to come up with the cost. So our estimate is that these ads on this sort of mean cost, which isn't a very meaningful number given the great variation in cost, would be $142 of advertising per insured person, or person who gained insurance. So it seems like a bargain to me. Colin.
So this is based on the total number of insurance ads, not just the state-based and the applicant.
Correct. Yeah. So this goes back to that original coefficient for the overall volumes. Yeah. But we would calculate them differently because the cost, and I have the difference. So predictably, the private sponsor ads were most expensive, but the state ones were only something like only $25 on average per airing cheaper.
Yeah, it'd be interesting to
Yeah.
test out
Yeah.
state ones. I also wonder, and I know you're not, of course you're not there yet because you haven't been able to look at the content yet of the ads. But we've talked about obviously this data set before, and it just strikes me that it feels very funny to lump the private and the state and the advocates together as insurance ads because even your examples of Hampshire and it covered Illinois seem more like enrollment ads, right? Because they're not, when I think of insurance ads, especially against private, it really is a marketing tool, right? To sign up for Blue Cross Blue Shield or whatever. It just, so I don't know, I wonder if maybe once you get into the qualitative, did you think about relabeling what that, because I think the labels, even sort of when you write it for studies, they're not, it suggests that private and state insurance ads are very similar, and I think they're probably pretty different.
Yeah. So we've done preliminary coding of the full data set of 1,000 ads that we have that were then aired multiple times, which is why we get this really big number. So, and they're in some ways more alike than you would think. So the private sponsors are still talking about open enrollment. They're still talking about get your insurance by March 31st. They're still mentioning, some of them, support can be available. Many of them I would think of as almost like name recognition ads for consumers who then go on the marketplace and are deciding between different issuers available. So I did a little bit of work a while ago on DTC pharma ads, and one of the function of a direct-to-consumer ad for pharmaceutical is just so, oh, Blue Cross Blue Shield is now in my mind, or whatever the insurer, and then when you then, even if you're going through the marketplace, you may consider that brand over another brand. And so sometimes the ads don't look as different as you might expect. Some of them absolutely do. They're really a marketing, the warm fuzziness of the company and its, the wonderful things you can get from insurance from that specific private company. But a lot of them have the same behavioral outcome in mind, which is enrollment during the open enrollment period.
Why then is there, I guess you don't have to
Yeah.
come to that chance, because why then would state turn up as significant and private not?
Yeah.
There's just more, maybe just.
Well, I mean, or I don't know. Yeah. These are pretty hot, off the presses data. We have just started to explore those differences across type insurance.
Two thoughts.
Yeah.
They both actually involve so
Okay.
in 2006, of course, there was the Commonwealth Connector that
Yeah.
Massachusetts had its own exchange, which was actually promoted by the Red Sox,
Yeah.
the Boston Red Sox, and is commonly attributed, the success of that is commonly attributed, at least partially, I don't know, anecdotally, to that. So I'm curious when you actually start looking at content to see whether local celebrity endorsement or promotion or sports figures, actually, I would think that would make a difference. But my other thought regarding Massachusetts is just thinking generally about this idea of what influences the decision of insurance companies to put out a bunch of ads.
Mm-hmm.
So Massachusetts, there was already, for example, a health insurance exchange.
Right.
And so perhaps the insurance companies, I would hypothesize, wouldn't be so eager to advertise about that. And so I think the general point is just that the relationship between the decision to put an ad out and into uninsurance is endogenous.
Yep.
I don't know how. I don't know. I'm sure you've controlled for a lot of great things, and I just wonder if there's anything that you're particularly worried about that might where the ad volume is actually an indicator of something else that actually needed to be done.
Yeah. So I mean, I'm most worried about the ground game. So the local grassroots community marching around enrolling people, and how that might be associated with the state and particularly state and the nonprofit enrollment advocate ads that we see potentially driving these. So it might just be that both are measures of we don't have measures of these local enrollment outreach activities, which may be correlated and maybe what's driving uninsurance changes in those counties. So I think that's what I'm most worried about. You're pointing to a lot of other really interesting characteristics of the competitive marketplace for insurance that could also relate. We hope, it's not my area of expertise, but thinking about it from a insurance market perspective, which is what my colleague Pinar Gretchen-Endy focuses on, I think she'll be able to run with a project that really focuses on that, that uses these ads as a marker of something else about the marketplace for insurance. The competitiveness, we started to look at how many, the sort of distribution of competitiveness of insurers. So some areas only had one private sponsor marketing in that open enrollment period. Some had 2, some had up to 8. So we are haven't done anything with that yet. But I think that can help us maybe better understand this endogenous relationship. Yeah.
Yeah, I would think that the purpose of a private ad wouldn't be so much to get enrollment, but of those who do enroll, get them to select.
Right. Yeah. That idea of reminding people about the brand when they go in. Yeah, I agree.
Just a non-detail.
So that's because the ads are aired at the whole DMA, and so when we think about the effect of an ad, we want to do that at the DMA level instead of the county level. Yeah, so it's just, I apologize for that.
The lower number was the county level.
Correct. Yep, so it change, the changes we'd be interested in trying to understand the cost effectiveness then has to be at the market level because County A and County B that are adjacent are getting that same exposure.
So you don't, I guess the problem with them, because there is some data on enrollment and outreach activities, but I guess it's primarily at the state level, is that what?
So we only have funds for navigators and enrollment in-person assisters at the state level. I would welcome.
Did you include that as a
Yeah. Yep.
Was that significant?
It was not actually. So I've already mentioned the various next steps we're taking in this project. So we'll be examining these relationships at the individual level, asking the question whether individuals' insurance changes and type of individual, kind of a subgroup approach, between 2013 and 2014 correspond with the volumes of ads aired in their county. We're doing that in the Minnesota Research Data Center using the restricted private versions of NHIS and ACS with county level identifiers, which are necessary for this approach. We'll also be digging deeper into the characteristics of the ads, as Colleen mentioned. For instance, what the language of the ad, the references to Medicaid in the ad, maybe other more qualitative details about the ads. And then we've already started to run a very similar analytic approach using ASPE enrollment data at the county level in healthcare.gov states, where our key outcome is enrollment rather than uninsurance changes. We are seeing similar relationships, but we haven't been pushing down that path as hard yet in our data analysis. So, if there aren't more questions, we can open it up. Yeah.
So there's been a consistent national demographic trend towards greater employment during exactly this sort of
Yep.
period, which one would also expect independently of anything else to lead to a reduction in the uninsured.
Sure.
Are you bringing that in?
So we have unemployment rates at the county level in 2013 and 2014, which are controls. Yeah. And are significantly associated, I believe, with our outcomes.
Have you thought about interstate spillover with some of that messaging?
We have actually, we haven't gone there yet, but that's actually an innovation of some of the political campaign work, which, for instance, in media markets that spill over state lines, so Minnesota and Wisconsin, you might look at people have looked at voter turnout and trying to use the state level differences across people who are exposed to the same message, but a message that's completely unactionable in the state where the candidate's not running. And so that's something we've started to think about, but haven't gone further with that.
Any way of knowing if people have a DVR or a TiVo or something like that that allows them to skip the ads?
Yeah.
So this why, right? I mean,
Yeah.
Essentially, like, it doesn't matter if there are a million ads. I just
Yeah.
forward. So I mean,
No, we don't have that variable. The ACS, as of yet, does not ask that question, I don't think. So my response to that is, so I don't necessarily care if people actually observed these ads or not, because I can think about exposure and the health behavioral response to be a network phenomenon, maybe. So maybe you didn't see it, but maybe you have a mother, a sister, a child, someone else who saw it and encourages you to enroll. And so this association is agnostic on whether the person enrolling was exposed or whether it was the blanketing the airwaves, and so other people within your community might have seen that. So it's kind of, again, this sort of ecological approach to media exposure doesn't care if people skip the ads or not. Of course, if everyone skips the ads, then there's no plausible mechanism of an effect. less likely with local media than national, but yeah, it's, important points about the very quickly evolving media landscape.
How do you explain that local news media messages had no significant correlation? I would think those are high quality in the sense of being trusted, and and the delivery people are trusted people who are. Why would that not seem to have an effect?
Well, I mean, it could. So I think we're pretty humble about our measure right now, which is just attention, just keywords referencing. So we really think of it more as a control for the other, sort of the level of discourse in that community about the ACA. In our other analyses, we actually use that sampling approach of the keyword hits and then pull down, literally pull from the servers the actual stories that were aired, and we've done coding of those stories. But that's kind of its own descriptive analysis in itself, and we do find some pretty interesting themes in news coverage around the positivity and negative of coverage. We actually find that on average coverage is more positive than negative. It's more negative at the start of open enrollment, but it becomes more positive. So I think we in sort of academic health policy discourse think that coverage was really, really negative, or at least that was my prior from attending to kind of national level coverage, and actually our local level measure of tone was much more balanced. There were many more positive stories than negative overall. So in other parts of this larger project, we'll begin to describe those differences.
So it could be that it had an impact. It's just the pluses and minuses, positives and negatives could have.
Correct. So right now, since it's just keywords, we're not adjusting for the actual tone and messaging of the news coverage, and we can't in this kind of big data approach. I mean, it's just impossible to code for every single news story. So what we do is we take a constructed week sample, and we ended up with only about we ended up with just over 1,000 stories, which is a very small fraction of the total stories, and we analyze those that are representative of that broader population, but we can use that measure to roughly approximate the tone within these markets, but we haven't done that, and I don't feel as confident that that would really realistically resemble the content.
Yeah, I mean, just on a separate question, but just on that point, I would think that geographic distribution of the tone might not be equal.
Right.
Right, so if you imputed it.
Exactly, and it's so different. And we're looking at in this paper, we're looking at a behavior that only happens once, which is enrollment in 2014, and we're aggregating across 6 months of coverage, and so volumes is appropriate there. But if one market's all of October stories are really negative, and all of their November stories are really positive, and we're creating an average tone variable, it's just hard to know how to interpret that across 6 months of coverage, whereas at least volumes we know mean the same thing. The meaning of a keyword hit, the tone might be different, but it still is a measure of attention that doesn't presumably.
I mean, the thing that's interesting is I do think suspect that insurance ads, and again, I think the real finding here is that the enrollment ads.
Sure. Okay. Yeah.
Back to my
Yeah. Framing.
opinion,
It's about framing. Enrollment
I
ads.
think this might be point out. We're all positive.
Yep.
Likely, right? Whereas you probably do find more of the wash in the local news and in the
That's true.
The political advertisements we know are all negative.
Correct. Exactly. That's a good point.
So,
Yeah.
if anything, I mean, the interesting thing about the political ads is that there wasn't.
They didn't backfire, right? So there was by no relationship.
Yeah.
Yeah.
Go up, but
Right.
in relation to other ones, you'd expect it, to maybe have a negative effect.
Yeah.
Or I don't understand what the direction variable, but
Yeah. Exactly.
I mean, so on that point, though, it did make me wonder on the political ads. Is it? I wondered if you wanted to do an interaction with the Medicaid expansion states.
Oh, yeah.
Because I'm thinking maybe
That's
the volume of negative political ads was probably higher in the non-expansion states. And
Yep.
then you might be able to find if there was any dampening effect.
That's
maybe
a good point.
actually.
Yeah. So we'll look for that, and we'll call it the Colleen hypothesis. But I think there's something to that, and we haven't looked at that.
Has anybody done a sort of small area? I mean, you could pick a small area, like one or two cities, and actually, really go down and have, a team of people watching a lot of ads and sort of trying to sequence with whatever the local issues were. Has anybody tried to sort of do a really detailed case study of this is what it looked like in a particular place over a period of time and the functions of the ads?
That's my knowledge.
Some value in complementing this type of analysis with some very localized thing where you can talk to some of the people that put the ads in.
Yeah.
Do like a doctoral dissertation, I can imagine, on these kind of things.
Yeah. Yeah, no, that's a great idea. Great idea. And there's a lot of data available within this data set on those local areas to start to describe them, and then look at a more case study or qualitative approach. But
I wonder if you now might want to just find like 8 or 10 people that you talk to, who pay for ads, and just say, what were you tell me about what you were thinking, what you were happy and sad about when you ran. Because there are definitely findable people that there's probably a fairly small number of people that are selling these ads.
yeah, it's a good suggestion.
Do you know if the volume of the ads in the next enrollment period and the enrollment period after that was similar?
Yeah. So I don't know the numbers off the top of my head. This grant only focuses on first open enrollment period, but we've been continuing to collect but not code or analyze the political ads and the insurance ads from open enrollment period 2 and 3. I know that the political ads referencing the ACA went up really dramatically during the second open enrollment period, because it was because the 2014 campaign was sandwiched in the center or at the beginning of it. I believe that I know that the number of creative, so the challenge with this data set is that there's different levels of analysis. So there's the number of ads, and then there's the number of airings of those ads. And I have access to the number of ads, which was about the same, but I don't know the answer to your question of whether the number of airings was dramatically different. Yeah.
So, going back to your intro, talking about what we know about the impact of media on various kinds of behaviors, we know that it's pretty important for smoking, but maybe not so effective around obesity. What's the sort of bottom line conclusion in terms of behavior related to public policy?
Yeah, that's a good and big question. I don't know. I mean, I think that there's, just as many findings where media and organized campaigns haven't shown any influence as there are where we've seen some influence in health communication. I'm particularly interested in what you described in the public policy implications of media. And I think that sort of from at least the work that I've done, because I can only draw from that corner in answering your question, I think media does shape people's attitudes about policy to an important degree. People don't get information about policy from researchers and scholars in this room. They get the information mediated about their public policy approaches, different avenues for obesity prevention in communities, all the way up to insurance enrollment opportunities. So it's my sort of base hypothesis that the media does play an important role in shaping how Americans think about their health policy options. The ways to test that assumption yield different results. So the typical approach that I've often taken, this is a departure for me, looking really at the ecological observational measure. I do a lot of online survey experiments where you just feed someone a message and compare their responses, their attitudinal responses, to someone who didn't get that message. And you often, if not always, can see differences in that very artificial laboratory-based survey experimental context. The observational studies, I think, are really important. in the smoking cessation literature, that's where we see campaign effects probably most prominent. But the kind of political attitudes, political psychology piece of it, how Americans understand and interpret public policy, is really where I am hoping to spend my research agenda. And I think it's a mix, but my sort of bottom line is that I think the media does play an enormous role. What media means, though, has changed too. And so thinking about the heterogeneity of media in informing the public about health policy issues is an important direction that there is not much work to examine so far. Yes, please.
In your future research, are you thinking of maybe analyzing the strategies that used in different commercial ads, or even for this kind of health-related ads, and trying to see specific strategies actually work or does not work for a specific segment of the population? I'm just wondering when that's part of your future agenda.
Only indirectly, to the extent that we are going to explore some of those additional coded variables that we have. We don't really have a strategic or public relations type person on our research team that might be able to categorize strategy and potential persuasive effect. And so we haven't really looked at that angle. That I think a different types of research can get at that. So we will be able to bring in some of these characteristics that we've already coded for, that I wouldn't say are about strategy, but are just about really rough variables for content, like references to the law. Do they refer to it as the ACA versus Obamacare? References to Medicaid or not? Spanish language or not? And so we can start to get at that as we relate to the individual level ACS and NHIS data, where we match people to the county in which they live. But no, I mean, I think there's a lot of data here, and there's lots of other disciplinary perspectives that could embellish it. This is one of those situations where we've amassed an enormous amount of data of many different types in a very small grant that's 18 months long. And so the number of things we can do far exceeds the time we have available to do them. But all of your questions point toward what else we can do in the limited time we have available on the project, and hopefully apply for a future grant.
And the graph showed a correlation between the uninsured rate and ad volumes.
Yeah.
Do those ad volumes include the negative ads as well?
That figure was only for our key statistically significant coefficient, which was on the insurance or enrollment ads.
There's basically no negative ad volume then.
No, I didn't include that. I mean, we could show that plot and it would be a flat line.
So I think you, with your colleagues, have also looked at the effect of media on public opinion.
Yes.
And I was curious whether you were interested in kind of bringing these two studies together in some way, because I'm thinking about Kentucky, for example, where you had these, stories about people who were enrolled in Medicare expansion in Kentucky, but would also say, I'm not going to, I'm going to change who I vote for, I'm going to vote for the Republican, or I don't like Obamacare. So kind of, they would come up in this study as maybe the ad having an influence on enrollment, but an opposite effect on public opinion.
Yeah.
Because you can imagine if people hold these contradictory, what seemingly are contradictory views at the same time. So I don't know if you have any plans for that, or?
Well, so the data source that we've used to look at opinion is the Kaiser Family Foundation Health Tracking Poll, where Molly and Brody has given us access to they have a DMA variable, and so we can link people to the DMA. The challenge then becomes kind of the timing of their surveys and the timing of our data. So to date, you've seen the paper. The only paper we've done where we've made that link is with the very first 2 weeks of October, because they fortuitously, in October 2013, fielded a survey on about October 21st of 2013, and we were able to link people by their market of residence to our media volumes from that first period. And so we're treating that paper as they're kind of fresh because it's the very first time people would likely have heard about the successes or the implementation process at that point. As we move further out, it's hard to think about how do we adjust for the milieu of attitudes relative to the media. So we don't have plans to do another analysis where we link to the opinion data, but it's absolutely right to do that. Part of it is we just haven't had the time or resources to dig into polling data that might be available that we could think about exploiting. I know California, Kaiser is doing polls in California that could be interesting over time. And part of it is we kind of want ideally we would want panel data of opinion. Larry Jacobs and Suzanne Mettler have a panel established to track people's changing attitudes, and they do show changes, which suggest, well, what's causing that change. I haven't talked to Larry about linking, but that again, there's lots of data sources that all we need to do a link is county or market of residence, and then we could begin to exploit other ways in which this media data varies with other characteristics, including public access. Yes?
Do you feel confident in attributing the impact to the media ads as opposed to the radio ads in access?
So in terms of where people are getting news from, so TV's dominant, but no, absolutely, we can't know for sure that there's not correlated information on other media channels and sources and outlets at the same time periods.
So I've observed a rocky road with MNsure, with some people calling into question whether it should become a federal exchange versus a state-based exchange. With that coverage of the operational difficulties, et cetera, how would you classify that in your media buckets? Would that be how would that fall into your media bucket? Because that would give some people cause for concern potentially and have perhaps a negative take on it as a policy. Maybe not the consumer, I'm not sure. But how would you fit that into different buckets of media that you work with?
Yeah, so for this study, any news story that references MNsure, health insurance, would just simply be a keyword hit in our variable that we adjust for on news attention. In our other study that corresponds to the aim 1 of the share proposal, when we're actually doing a very close and intensive content analysis of a strategy, we create sort of a mock, we pull a stratified sample by week over the 6-month open enrollment period so that we have a representative population of news stories. And if we were to code that MNsure article, we would likely we have a valence code, so we would likely code that as a negative news story referencing health insurance enrollment. And then we would code it for other details too. And we're still analyzing that data.
If there's no more questions,